Hi, my name is Kylie Gonzalez, and this semester for e-commerce, I decided to research e-commerce's effect on healthcare and the medical field in general, and what aspects of that were advanced because of e-commerce and what were brought down, threats and opportunities. So what I've come to realize is that the movement is more of a clicks and mortar type of deal where Americans can go online to schedule and access care. I mean, they can set up an appointment with a physician before they even have to walk into a hospital. They can research their symptoms to to see if it is severe enough to go to a hospital, but ultimately saving money and time, which is everybody's main goal, really. But currently hospitals everywhere are using electronic medical records or EMRs to keep track of patient histories, and the movement into digitized data has streamlined the process of patient care because it eliminates, the need for paper documents and paper trails, reduces storage and errors, and generally allows for a smoother handling process. Um, the ease of access for the physicians, though, uh, just being able to access all of that information as quick as possible and in a standardized format allows for quicker diagnosis and decrease in patient waiting times. There's less lag time between appointments. There's less lag time between nurses and doctors, and everybody knows how long it takes to go to the doctor. You're going to be waiting forever. So ultimately, it just improves the quality of care that patients are experiencing and that doctors are giving. So yes, improve quality of care. The EMRs, though, specifically, can allow a patient full access and control over their medical records at any time. So you're looking at ubiquitous use, and it just gives a patient more control, and they can see what their doctors see. But also you can take the EMRs and you can look them up under your insurance provider, and you can upload them to websites like WebMD, and you can compare your background with symptoms, and you can compare it to new symptoms, and it's just a whole new level of electronic medicine that I don't think a lot of people expected. Um, you can also, once you've uploaded them to WebMD, you can take that website, you can show that website your uploaded symptoms to any doctor. I mean, it's all there. It's on a smartphone, or it's online. So it's ideal for somebody that travels a lot, or doesn't really have a primary care physician. Um, and it means a physician can compare current symptoms with history for an more accurate diagnosis. But ultimately, I think the greatest advancement for that has been eClinicalWorks, which is a software program developed to help streamline patient care and hospital workflow. It's just like a fully unified system where once the doctors have the program set up, they can do anything from check in a patient to transcribe notes from a visit. E-prescriptions, they can automatically send prescriptions to the designated pharmacy. And it also handles billing and filing, so it updates electronic medical records. So it's all contained in one program, and many of these hospitals are employing this program to standardize usage, and it's the ultimate undercut is streamlining. Furthermore, with the program of eClinicalWorks, it's just providing technology and services that ultimately reduce costs and reduce errors as far as duplications or mistakes. But it's not just eClinicalWorks and other business models. It's also a business to consumer um, model that is developing. There are things that will monitor and record every aspect of your body's function. I mean, to a certain point. With things like the iWatch, you can monitor heartbeat, you can monitor blood pressure, you can monitor glucose levels. All of those things are important for, say, a diabetic. So a diabetic can connect directly with his body through this technology on its wrists without having to draw blood and prick themselves every morning and etc. It's also a 24-hour surveillance of their body that their doctor could not have otherwise. So once these records are sent to their doctor, I mean, a doctor can form a quicker and better diagnosis. And quicker and better diagnosis leads to quicker patient care, which leads to better, improved patient care, which is the bottom line. But one segment of the healthcare field that I believe could be significantly improved by e-commerce would be mental health and psychiatry. I think that psychiatry is probably the best form to move almost exclusively to the internet, because it requires no physical contact between a patient and a doctor. So yeah, so a patient could potentially access their list of physicians via their insurance provider, which is a standard thing. I mean, it's current today, but from that point, it's not a matter of which doctor is closest to you. It's a matter of who you're covered under and what kind of care they can provide for you. I mean, you can pick a doctor based on bargain shopping. You can pick a doctor by evaluating their merits and their credentials, or prior client reviews. I mean, it is a matter of location, because location is no longer a structure. So you can book an appointment, and from this process, just from booking an appointment, you can go from filling out all medical records online through EMRs, just uploading them on there. You can provide proper identification. The doctor can then order electronically through a hospital software system that this patient go to the nearest hospital and have blood work drawn. And those results would be sent directly through the internet, through encryption, to the doctor. And it just, there's no need for travel and for paperwork and for any of this, any of the things that delay patient care. So from there, you can either have two options. If obviously, if the patient is within a certain range to the doctor, they could set up an initial face-to-face meeting, but it isn't necessary. So proximity is not an issue with e-psychiatry, because there's no need for physical boundaries. So now that the physician has all the necessary requirements to treat a patient, including their history, including their blood work, including identification, they can set up a video conferencing chat via Skype or other programs like that, and they can have hour-long sessions, 2-hour-long sessions, without the constraints of a typical business workday, without the constraints of who is the closest physician. I mean, and it's better overall, especially for people that live in rural areas that are 40 miles away from the nearest city, because not a lot of people are going to justify driving 40 miles for an hour-long session with a psychiatrist that they probably believe they're paying too much money for. For companies such as the Elk River Treatment Program, which is a treatment program for troubled youths located out in rural Tennessee, up in the mountains, it's difficult to find therapists that understand what is taught in that residential program. So using e-commerce methods such as availability of physicians through Skype, those same therapists that these children are connecting with out in the wilderness on a deeper level, they can Skype across the country and provide a better continuity of care. The outpatient treatment from any location can result in better understanding and handling of what that child needs, and it's a big step towards ensuring mental health. But there are a lot of drawbacks to e-psychiatry and e-healthcare in general, foremost of which is probably hackers, because everything to do with medicine is sensitive information. It's personal information, it's social security numbers and medical records and history, and it's not things that people want other people to see, other people besides their doctors. So, with the threat of hackers, doctors and physicians and all these programs have to make sure that their sites and their programs are well encrypted, so they can provide security and reassurance for patients. Because a lack of trust and a lack of reassurance it's going to be the downfall of the system. No one's going to utilize it if they think that it's available to anyone. Another possible drawback would be, if you're video conferencing psychiatric sessions and you have an unreliable network, it can really darken the reputation of a therapist or of a business. You need a dependable Wi-Fi network for these things to work. Obviously, and the patient and the doctor would both need video conferencing capabilities, computers, cameras. You could even do it through FaceTime, but who wants to sit with their phone in front of their face for an hour? It's just not. It's not really reliable. So the Wi-Fi networks and reliability and things like that. I don't see that being a problem something 5 years from now, because Wi-Fi networks and connectivity is advancing every day. Connectivity shouldn't be a problem in probably about 5 years. It's just like every household had a landline phone 10 years ago. Now every household has a Wi-Fi network. It's just the standard of things currently. Another turnoff for many patients in e-psychiatry and e-healthcare is the secureness of the website. If a website looks cheaply made, if it misdirects or it doesn't load or it's got a long lag time, if it doesn't perform as it is supposed to perform, it can turn a client off, because if the website itself isn't performing, why would they believe that the website is secure? It's the same thing as walking into a doctor's office. If you walk into a doctor's office that has all kinds of medical plaques and degrees on the walls and it's comfortably furnished, you're going to feel more secure. You're going to believe that this doctor knows what he's talking about, that this diagnosis he's going to give you is correct. So it's the same thing as a website. It's got to be streamlined. It's got to be up to date and in working fashion. But really, in conclusion, the expanding roles of technology are changing the way we handle healthcare, and every day we're advancing towards more streamlined processes that just reduce time, waiting, that reduce lag time. They reduce stress on insurance companies and patients and doctors, and they allow for a better workflow and management for doctors and hospitals. So ultimately, we can expect to see e-commerce completely advancing the medical field. And I think it would be for the better.